because I love to talk, and I am often harassed to give the microphone to the next person, so I'll try to make it brief. But as she said, my name is Allison Tupper. I am a speech language pathologist or a speech therapist, same thing, by trade. How did I get into that? Oh, that's a long story. I've never stopped talking my whole life, so I just thought it was an easy career path for me. So I am a UND graduate. I'm from a small town in North Dakota, and went to UND for my undergraduate degree, and then went to Reno, Nevada for my master's degree. I've worked all along the West Coast, Idaho, Oregon, in Colorado, and then my family, we moved back to the Midwest in 2020 during the pandemic, and I've been here at Astera Health for 2.5, almost 3 years. I've been a speech therapist for about 20 years. So I'm going to talk to you guys today, and we know that the topic is mom safe at home, right? So we know mom is just kind of the proverbial, maybe aging person that we're thinking about, and is this still a safe place to be, and how do we know that, right? And that's a tough topic to talk about. That's a tough thing to handle. My grandmother had Alzheimer's dementia, and I watched my family kind of go through the stages of putting her in a smaller apartment so she wasn't at home, and having to take the license away, to assisted living and into memory care. So this is a topic that is kind of near and dear to my heart, and it's something that I've watched go through. I was, of course, much younger, didn't have much decision making in that, but do understand that it's not always a go from step A to step Z. There are lots of ways that we can look at how we transition in life, and also how we maintain some of our abilities, so that doesn't always need to be you can be at home or you need to be in the nursing home. Okay, so I'm going to talk to you guys today about rehabilitation. Specifically, our outpatient clinic. Here at Astera Health, we do have outpatient therapy for occupational therapy, physical therapy, and speech therapy. We also have a cardiac rehab program and respiratory therapy. So we do a lot under our roof as far as keeping our bodies and our brains in good health. Maybe. There we go. All right, so the first thing I'm going to talk to you about is occupational therapy. Not to be I think about occupational therapy as what occupies your daily life, not your occupation for work, okay? So occupational therapists, and in the outpatient setting, we're gonna look at our fine motor skills, activities of daily living, so dressing, feeding, navigating your household, the community. Can your loved one open pill bottles? Can they manage their medications? Things like that. We look at fitting people with assistive devices, what they might need as far as different handled silverware, reachers, grabbers, and then also looking at visual motor and visual perception skills, okay? And as you can read, and I know you have the handouts, I'm not going to read them to you, but there's lots of things they look at and things to consider. These are just some kind of bullet points on, do you have the right shoes on? Do we need to do different things instead of reaching over, or tie shoes? Do we have the slip-ons? Devices to help open jars, things like that, and that's kind of the basic for the outpatient setting. Underneath our occupational therapy kind of profession, we are now here at Astera Health providing what's called a driving risk assessment. And this is a brand new program we launched about a month ago. And it's been very helpful for, again, is mom safe to be at home? Is mom safe to be on the road? And so what we do is that you would need a physician or your primary care provider's prescription for an occupational therapy driving safety assessment. And we talk about it, it's a risk assessment. What is your risk? What is mom's risk for driving? So what we do is we go through, it's not an on-the-road test. We're not that brave, okay? No, I'm joking. We do everything in clinic to this point. So we look at your cognitive or mom's cognitive abilities, physical abilities, reaction time. We actually have a reaction pedal, so we can test how easy it would be to go from gas to brake. And then we have results that we can kind of compare those to know what's safe on the road. And then from there, we present those risks, that risk assessment back to the physician, who would then talk to mom about what her risk would be to be on the road. There are 2 regional clinics in this area that do provide an on-the-road driving assessment, should it go there. That's Sanford in Bemidji and Lake Region Healthcare in Fergus Falls. And they will do the assessment, and then they also go out in the vehicle, mom's vehicle, and drive with her. They do have some out-of-pocket expenses. That's not all covered by insurance. So based on that driving risk assessment, this is what would be sent back to the physician, showing, are you green? Green light, you're good to go. We didn't find any major risks in driving. We yellow, caution, maybe there's some safety risks. We may recommend an on-the-road medical assessment like the one in Bemidji or in Fergus Falls, or potentially having the DMV reassess mom at that point. Or do we send the note back to the doctor saying, this is red, we need to stop. We're not at a safe place based on these assessments for mom to be safe on the road anymore. But that's a conversation with the physician and mom, not anything that we would take a license away from. We also provide physical therapy. I think everyone kind of understands physical therapy, but we like to review it. We do in our clinic here at Astera Health evaluation and treatment, flexibility, strength, balance. If mom were to have her hip surgery, once she's progressed from maybe outpatient or home therapy, they could come to do outpatient therapy with us here. And then we also look at different ways that we can start an exercise program. So sometimes we assess, and maybe mom has dementia, and coming to outpatient therapy might be a lot. We could recommend an exercise program that she could complete at the MAS exercise center or something like that. So we can keep mom in the community, but maybe with a physical therapist recommending, let's not jog on the treadmill or take Zumba or anything like that. They will also look at assistive devices, wheelchair assessments, things like that. And then we get to the good one. No, bias. So speech language pathologist, myself, we do all of the cognitive evaluations. So if we're thinking that we're seeing some changes, it's my job to go in, do an assessment with mom, kind of find strengths and then also maybe weaknesses. Again, it's not a punitive, you shouldn't do this, you shouldn't do that. It's, we might need more help with this. We might need more help with medication management or managing your schedule or scheduling appointments. We also look at language, word finding. We all get it every once in a while that, ooh, I can't come up with the word, but this might be if it's impacting mom's ability to communicate, to call for help, to talk with her doctor at appointments. And then also swallowing is a big one. So if mom's having trouble swallowing or cooking for herself or making the right food choices, that's something that we can kind of help with as well is managing that. These are my 4 healthy aging tips. I can't not tell people good sleep and rest, make sure mom is sleeping well, proper hydration and nutrition really can impact brain health. Getting up and moving safely helps promote blood flow to the brain, gets oxygen to the brain. And then we know after COVID, socialization is so important, and being out and being in the community is so helpful. And it really keeps our brains active for as long as we can. I just want to stress the importance of early intervention. The sooner that we see mom in the clinic, with her doctor, in the home, wherever it is, wherever we need to get those assessments, the faster we can help. provide those things, sometimes prolonging deterioration of certain skills. So being able to say early on, this is something we should look at. There's no harm in that. An evaluation doesn't mean you're going to be signed up for 12 weeks of physical therapy. Sometimes it just says, here's where we're at, here's a great baseline. We can track this over time, or we can give you an exercise program. You can go on your merry way. It doesn't mean you're going to be locked into therapy. And if the outpatient model doesn't fit for mom, we can find that for someone, we can find a different place, whether it's home health, in the assisted living facility, getting hooked up with the activities director. It's never too late to start a program to stay healthy. Okay? That is the end of my presentation. Any questions off the bat? Nope. Save them till the end, okay? Thank you guys very much. I'm going to introduce you to Luke. Luke is going to talk to you about our swing bed program here at Astera.
Hey everybody. I recognize a few of you anyway from the community. I guess I'm supposed to talk about how I ended up here and in nursing. About 2003, I decided to fall out of a tree while I was putting up a deer stand, and ended up in the emergency room here back when it was Tri-County. Ended up getting a bunch of staples put in my head and checked out everywhere else. Had a male nurse. He told me I should consider nursing. I laughed and told him that's a woman's job. And he was a heck of a nice guy, and he laughed with me about it. And then we talked more about it, and he got me kind of considering it. From there, I went into work first at a nursing home, then children's psychiatric facility for the state of Minnesota, then in the psychiatric unit and med-surg units over at Lake Region. And then I came back to Wadena with my family, and my wife is also a nurse. I started over at Fair Oaks Lodge doing assistant director of nursing duties. And then I went into home care for Vivi. Back then it was called Knut Nelson Home Health. And now I'm at Astera. Currently a utilization nurse here, so I look at some things with insurance and people's hospital stays. And then I'm also our swing bed referral coordinator. A lot of people don't understand really what swing bed is, and so I try and always clear that up for people. Swing bed, it's not a bed that swings. That would be way more fun. But say mom or dad falls out in the community and they end up in our emergency room and then our hospital because they need their hip repaired. Or maybe they developed a real bad wound, or they end up with a real bad infection. Now they need some therapy. Swing bed is a service that Medicare came up with back in, I think, the 70s, and it basically allows small rural hospitals to switch the way they use their beds. Rather than being an acute hospital bed, it swings to becoming a rehab bed, and they can bill accordingly at a lower rate than they get for inpatient. It's been kind of a lifeline for the small rural hospitals, allowing them to, when they have open beds, keep them more full and thus keep income coming in and keeping them open, but also helping to bridge the gap between hospital and home. Most commonly, people come into swing bed and they go home afterwards. Most of the time, they don't need to go to a nursing home then. There are times where progress is limited and things change and we have to look at that, but for the most part, people go home after a swing bed stay. Usually it's a short-term stay, so instead of it being several months, swing bed is really designed for like maybe a few days or a week to maybe a few months or a couple months typically. In that time, people have to have a skilled need that we have them there for, which that might be daily IV antibiotics, might be daily or extensive wound care, therapy. We do a lot of therapy with the same staff that Allison was talking about over in our outpatient department. And there's a few other things that we can do it for. We can do it for education on a new condition, just to get the person good enough to go home knowing what they need to know about that condition too. So it's covered by Medicare. Usually like the first 20 days a person doesn't have to pay for. Medicare covers it if you have Medicare. If you don't have Medicare, quite often cost can be prohibitive. MA does not cover swing bed services. With some rare exceptions, some commercial insurances do under certain circumstances. I'm thinking of like maybe a car crash or a workman's comp type thing. We've seen a couple of those. When people are in swing bed, it's not much different than when they're in the hospital. So you have to have a 3-day qualifying inpatient stay. It doesn't have to be here at Astera. It can be at any hospital. It could be St. Cloud, it could be Fargo, it could be Alec. We then get a referral, or if you're already here, usually I come talk to them about, hey, the team is thinking you might really benefit from a swing bed stay. I'd like to tell you more about what that is, and then we have that conversation. If it's a referral, I get the referral, we go over it with the team, and we decide how can we be of help to this person? What can we do? Do we think we can give them what they need to succeed and go home? From there, I usually reach out to Alicia. She's here with us tonight, or some of her coworkers. They work in our prior auth department. They check insurance to make sure that if we accept the person, they're going to have insurance coverage, or that we can figure out a way for it to be paid for. We don't want somebody to get here and then get a bigger bill because insurance ends up not covering it, and maybe we wouldn't even be able to bill for that. So we always check into that so people don't have to worry about it. And then Alicia and her team often take care of reauthorization if we need to extend the person's stay for some reason. Maybe they're making progress but need a little more time to be able to successfully and safely go home. Their care is not much different than when they're on the medical floor. So we have doctors, we have nurses, we have PT, OT, speech, dietitian, pharmacy, all of those disciplines still working with the person, still available. The main difference that I tell people is, instead of seeing the doctor every day, like when you're in the acute care hospital, they typically will just round once a week, because when you're in swing bed, you're deemed relatively medically stable. And unless there's something that comes up that the nurses or other disciplines alert them to, the doctor will plan on like a weekly visit and as needed thereafter. So not to say that you wouldn't get a doctor's care quite quickly if something arose. And that's actually one of the huge benefits of swing bed, is if somebody is a little more frail and a little more medically complicated, if all of a sudden something pops up and they need help, we got doctors right there, we got lab right there. You don't have that at a nursing home. So if you choose to do rehab at a nursing home, it's something to consider, because if your loved one is a little more frail, or if you're a little more frail or medically complex, we have some services readily available that you might really benefit from. So typically, like I said, the first 20 days are covered. After that, there's usually a copay. If you have a supplemental insurance, quite often that will pick up the rest. So most patients leave swing bed with relatively little to no bill, which is also a really nice thing. It's covered much the same as a nursing home rehab would be. We do have some limitations. We can't have people there indefinitely. We aren't a long-term care facility. If people are at real risk for wandering, we have to be a little bit careful with that, because we are not a locked unit. And there is that chance, even though we have people watching and we have security and we have measures in place, we still have to be real careful with that. So sometimes if people's memory is a really significant concern and we're worried that they might wander, sometimes we'll recommend a longer term care facility for those type of people. And I think that's basically what I have. And we'll do questions later, right? Okay. Yeah, does anyone have any questions right off the top of their head? Otherwise, I'll be available later as well. So a lot of insurances, and maybe Alicia can correct me if I'm wrong, but a lot of insurances say that swing beds should be a couple weeks maybe expected to maybe a couple months. The exception to that is like, say somebody needs 6 weeks of IV antibiotics every day. And then they do some repeat imaging or some repeat labs, or the doctors find something that concerns them. They might consult infectious disease. Infectious disease might say, I really think you should do another month of IV antibiotics. This is just a hypothetical, but that would be the kind of instance where we would reach out to insurance and say, well, now this has come up. They're still needing it. Can we go a little longer? But typically it's limited to a couple months at most, in most cases. Any other questions? Does that answer your question? Yeah.
Medicare does have a 120-day per calendar year that they will cover totally. So your first 20 days are covered with no copay. Days 21 through, it's either 100 or 120, then are covered. Then after that, there is no coverage for swing bed.
Yeah, so
Okay.
it,
doesn't have a limit, it's based on insurance.
Based on insurance.
yeah,
Based on insurance.
yep. So a person could private pay for a swing bed. For most people in our small community, the cost can be a prohibitive factor. But we do talk to people about that. We're very upfront about that. And I don't know if everybody heard when Alicia was talking because she didn't have a microphone, but Medicare does have a limit. It's around 100 or 120 days of skilled nursing home or swing bed care that they will pay for. So that would be the max in a year. Kim, who did you have slated to talk next? Okay.
Sounds good, thank you. Okay, well, Kim is getting the PowerPoint set up. I can introduce myself. My name is Brianna. I work for Vivi Home Health, formerly Knut Nelson. We just went through a rebrand at the end of last year. The reason for the rebrand was just we merged with Walker Methodist down in the cities. And so with two companies becoming one, we had to come up with one name for both companies. But we still have our office right here in Wadena. Our staff is still local to Wadena. None of our values or mission have changed. It was truly just a name change because of the merger. So if you start seeing Vivi around, which you will see it more, it's the same people as Knut Nelson. If you call us Knut Nelson, we will answer. But just so if you start seeing it, you're not like, what, another company? No, it's the same. But anyways, so a little bit about me. I am an occupational therapist by background. I've been with Vivi, it's gonna be 5 years next month, which is crazy. Now in my new role, I get to do more outreach like this and education. I cover the Alexandria, Wadena, and Fergus Falls area, so I'm kind of all around. Yeah, okay. Oh. Okay, so I'm gonna talk a little bit about our home health and our home care services. So we're gonna start with home health. Home health are the services that are going to be covered under your Medicare benefit. Also, VA benefits will cover it as well. So these are services that you will not have to pay for out of pocket. So what is home health? You get to receive a high level of skilled care right in the comfort of your home. And the services are designed to keep you in your home and kind of adapt to maybe your new way of life if you're recovering from like a surgery or an injury or a recent hospitalization. And again, Medicare covers home health services at 100% as long as you meet 3 requirements. The first one is we need an order or a referral from your primary provider. So if you're in the clinic and see your provider, they can send a referral, or if you're in the hospital and you're ready to go home but need some more help, the referral can come from the hospital. The second thing is that you need to be homebound. So this is a kind of a scary word because, as my grandma told me, I don't want to be a prisoner in my home. So homebound is not as strict as people make it think. You obviously will be able to leave for any medical appointments that you have, any dentist appointments that you have. You can go out to get your hair cut. You can go to church. We're not going to stop you from going to church. You can leave for like infrequent events. So, for example, when my grandma was on home health services, it was the year that I got married and I had my bridal shower and she was super upset she couldn't come to it. And I'm like, Grandma, it's going to be challenging for you to get there, but if you can get there, it's a couple hours, you're going to be back. So those like infrequent events. I had a patient who loved one passed away while I was seeing them and they thought they couldn't go to the funeral and I said, no, go to the funeral. So if you have questions on your home, if you're homebound, our staff are really good at talking to you about it and then kind of figuring out next steps before we'd ever discharge anyways. And then the third requirement is you need to be making progress towards your goals, typically for therapy. So in home health, we get approval for 60 days initially. That doesn't mean that we're going to see you for all those 60 days. So if you meet all your goals by 30 days, well, then you'll be done in 30 days if you've met all your goals and you're back to what you were doing before. Sometimes what happens, we hope it doesn't, but sometimes maybe after an illness or an injury, we work on you with therapy and nursing, and we realize that you're no longer making progress. We call that kind of a plateau. And so if you're no longer making progress towards goals, and maybe now this is your new baseline, your new normal, we help figure out to keep you safe at home, and then home health is done. It's not a long-term thing. Yeah, and if you ever are on home health or a loved one's on home health, our staff is very good at kind of talking to you about where you're at with your progress and when we're going to get close to discharge. We never surprise you with just, we're going to discharge you tomorrow, because that's no fun. So what can we do in home health? So we have nursing, therapy, and home health aides that can come right to your home. Some of the things that nursing can do, they can help with just disease education and management. If you have any wound or ostomy, they can do that care right in your home. They kind of help, the nurses kind of help coordinate all your care, and then they can help with medication management. So if you have a lot of changes with medications, which sometimes happen after you come home from the hospital, there's some changes, they can help get that all figured out. They can do like infusions or IVs, things like that, if you have in-home setup for that, and they'll help you with that. We do have, if you're on our services, we do have a nurse that's on call 24/7 to answer any questions. Sometimes it can just be a quick phone call, your questions answered, that's it. Sometimes, they may need to come out and see you after hours, or sometimes they call you and they say, you need to go to the ER. So they can kind of help triage and figure out what you need at that time, which is kind of nice. So physical therapy, I'm not going to go in a whole lot of depth. We just talked about all the therapies, but the biggest thing with like physical therapy in your home is if you're not quite strong enough to get to like outpatient therapy yet, or if you're homebound for maybe you have wound care and the nurse is doing your wounds, the therapy can be done in your home. And then if and when you graduate from home health and say you need some more therapy, we can then send you back to Astera's outpatient, and they can continue with that once you're done with home health. Occupational therapy in the home is a little bit different because what we're in your home, we get to be very specific to what your needs are in the environment that you live in. So making recommendations for like grab bars in the bathroom or specific shower chairs or do you need a lift chair in your living room? Those are all things that we can help make recommendations for because we can see the layout of your home and how you move around in it. Our occupational therapists do all of our wheelchair assessments. So if you need a wheelchair and you can't get to the outpatient clinic to get an order for one, our therapists can do that as well. We also have our occupational therapists do some memory assessments or the cognitive assessments. The main one that our therapists use is called the CPT. It's called the Cognitive Performance Test. The reason why we use that one, so if you have a loved one that you're concerned about their safety at home, you've noticed a lot of changes with their memory, but you don't know, is it time to talk about moving? Is it time to have more help in the home? This test is really nice because it gives you concrete recommendations based on how they do everyday activities. And so it can give you the recommendation that maybe they do need 24-hour supervision, or they are safe to live alone as somebody checks on them once a day. It's very unique to the individual that we're seeing, and then it just helps families make some of those tough decisions. Now, it's not a diagnostic criteria, so we can't diagnose them with anything. We can't make you guys listen to the recommendations, but I know for a lot of families that I work with, they're seeing those changes. They already have those concerns. And so now having something in writing that, okay, I do need to check on mom at least once a day, or somebody should be there a couple times a day. Like it helps to make it more understanding for you guys and for your loved one that's going through it. And then we do have a couple occupational therapists and physical therapists that are lymphedema certified, and they can provide that service in your home as well. And then our last therapy that is covered under Medicare is our speech therapist. So similar things, they can look on that high-level cognitive training, swallowing, voice, language. They can do some of those things right in the comfort of your home. We cannot do swallow studies in the home, so if a loved one needs that, we would then refer you to outpatient to get that done. And then lastly, under your Medicare benefit, as long as you are receiving one of the other skilled services, so nursing, PT, OT, or speech, a home health aide can come out to assist with showers once a week if that's needed. Sometimes it can be more frequent than once a week if there's like incontinent issues or wound that needs to be changed, the care every couple days. So it can be more frequent, but typically one time a week is what we see. Okay, so then our home care services, so these are other services that can be in the home to help keep someone there longer, safer. These are just services that Medicare doesn't cover. So they are a private pay. There was a sheet outside that goes over kind of the pricing too. If you have specific questions, we can talk about it later. But these are just things that Medicare don't cover, but some people still need help with. So we have personal care services, nursing, remote health monitoring, a personal emergency response system, and a medication machine. Okay, so some of the personal care services that aren't covered under Medicare, you can private pay for them, are going to be more of that long-term in-home support. So if you or your loved one have maybe finished up with therapy and you kind of hit a point, or your loved one hit a point that they just need some help with this. They're not safe to maybe shower by themselves anymore, or their laundry's in the basement and they're just not safe to go up and down the stairs anymore. Because Medicare is not paying for it, we can do a lot more private paying. So the home health aide can be out there and help with personal care like dressing, bathing. They can run errands. They can go get groceries for you. They can do some of that light housekeeping like vacuuming, mopping, cleaning the bathrooms. They can help with laundry, and they can help prepare meals for the week. So that's some of the things that the personal care services offer. Our nursing support, so they can do some of that like long-term medication management. So Medicare doesn't cover medication management by a nurse forever. And so when it comes to a point that they no longer cover it, but you still want that for yourself or your loved one, you can private pay for that. And they can come out, once a week, set up your medications for a week or whatever you need. They kind of tailor that to you. The remote health monitoring. So these are little tablets that you get, and it comes with a blood pressure cuff, a oxygen reader, a scale, a thermometer, and it's really good for people who have like high-risk patients with a lot of medical complexities, so maybe a lot of comorbidities, a lot of diagnosis, or maybe even a new diagnosis, like you just got diagnosed with chronic heart failure. What do I do? What this tablet does is it monitors your vitals, so you take them every day, and it can catch trends before you become hospitalized. So if you have chronic heart failure, one thing we're worried about is weight gain, right? Because that means your heart's not working, you're retaining fluid. If you're checking your weight every day and then you track it on this tablet, if you see that graph is steadily going up, 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 up every day, maybe it's a time to call my doctor and be seen by my primary care doctor to make sure my medications are correct or that I don't need to change something. A lot of times what happens is people don't notice those slight changes, and then they get to a point where they've gained 10 pounds in 2 days and now they're in the ER. And so it can help to kind of just bring awareness to some of those things. The tablet also has like education on your chronic diseases if you have those. And then we have seen that there is a reduction in hospitalization if people have these. And our staff will come out and show you how to use them. We don't expect you guys to know how to use them without getting some education on it. And then we have our PERS units or fall pendants. We have 2 different kinds, which is really nice. They both go off GPS. So they will detect a fall wherever you are. You could be in your home, you could be out in the community, you could be visiting your loved one in Iowa or wherever they are. It will detect that fall. The 2 that we have, one goes off Verizon wireless towers, one goes off AT&T towers. So if you live kind of in a rural area, we just make sure the one that you're getting is going to work where you live, basically. And so there's 2-way voice communication. So if you press that button because you fell or you have a medical emergency, you need help, you'll be able to talk to the person directly through the device. And then the nice thing too is that if you fall and say you or your loved one gets knocked unconscious, it will detect that sudden movement and just call the help center right away. So if you're not able to press the button, it will call them. Now, if you accidentally press the button, because this happens, they'll call you and they'll say, "Oh, Bob, you pressed your button, are you okay?" And it was an accident. You can say, "Nope, I sat on it, it's fine." They cancel the call. But if you press it and you need help, you can say, "Yes, I need help." So that's kind of the nice thing about it. And then lastly, we have our medication machines. So these are really nice for people who are maybe really forgetful at taking their meds or maybe get confused at what meds to take at which time. You can have a nurse set it up, or we can teach family how to set it up. But what happens is once the medication box is set up and you close the lid, it locks. So your loved one can't mess with the medications, they can't move them around, and then you program them for whatever time of day they take meds. So if they take meds at 8 a.m., noon, and 8 p.m., at 8 a.m., the machine will be very annoying and it will beep really loud and only open up the compartment for the medications that you need to take at 8 a.m. And it will not stop beeping until you dump the medications out. So I always tell families at that point, we can't guarantee they swallow them, but we know for sure they've dumped them out, or the machine will keep going off. And then once you take them out, it locks again. And then at noon, when it's time to take the neck meds, the next box will open up. So that's kind of nice. It gives family a peace of mind that they know that their loved one's not moving medications around or taking them at the wrong time or taking the wrong dose. Yeah, so that's another option that we have. Any questions at all? Yeah.
So what is the cost of the remote health monitoring and the PDRS?
Yes, I should have grabbed one of my sheets, but give me 1 second. I should have it memorized, but my brain's not working. And they just changed it, so that's also why I don't have it memorized. Oh, thank you. So if you grab one of these sheets from outside at the bottom where it says Personal Emergency Response System, so there's a $60 monthly fee. So every month you'll pay $60, and usually we set it up where it's just direct deposit, so it'll just come out. If you want to write checks every month and send them in, we can do it that way too. And then there is a one-time activation fee, and there's 2 options for that. So if you would like our staff to come to your house, set it up, make sure it works, do that first. They do a first call to make sure that it actually connects to the call center. They have your right address, they have your right name. That's a one-time $90 fee. Now, if you don't think you'll need all that, if you think you can handle setting it up yourself, which some people can, we will mail it to you, and that just costs $45 to ship it. So you'll have that $45 fee to ship it if you don't want our staff to come help set it up. Yeah.
Tell them a little bit about the gait and balancing training,
Yeah.
and what does it do?
Yes, so you were asking a little bit about the gait and balance training with the physical therapy. And so what the physical therapist will work on, so gait means walking. So it's your walk, and so if you're having issues where you feel unsteady on your feet, or you're worried about falling, or maybe you've had a fall, they can work on some exercises that will strengthen those muscles to help keep you more stable when you're walking. I'm not a physical therapist, so I'm not going to pretend to be and tell you exactly what they'll work on, but a lot of times a lot of exercises on your legs. And then if needed, if they're working on these exercises and you still need some more help, they can help too to figure out if you need a walker or a cane, and then teach you how to use those safely if they can't get you strong enough without it. So the biggest thing is just kind of prevent those falls and make sure you can move around your house safely. Yeah. Any other questions? Yeah. Okay. All right. I'm going to move it on to hospice.
All right, so my name is Sherry Greenwald, and I am a nurse navigator here at from our office in Wadena, but I also cover Wadena, Fergus Falls, and Alexandria. And so what a nurse navigator gets to do is I get to do outreach in different facilities. I get to come and do these events with you guys, do a lot of education around hospice, because as a lot of people know, they think hospice is for the end of life. And that's truly not what it is anymore. Things have changed in the last 5 to 10 years where people could come on hospice much sooner. So I get to do all that, and then I get to work with families, and I can do informationals on hospice, so you guys can have that personalized visit from either me or one of our other staff members. And so I have been a nurse since 2017. I actually went to school here at M State. Got my 2-year degree, and then in 2019, I decided to get my 4-year degree, and I went to NDSU for that, and I was a COVID graduate from the 4-year program. So I've worked in the hospital setting, I've worked in a clinic setting, I've worked in public health, and now I'm here at Vivi. So it's been a fun ride. And who knew that I would end up in this role as a nurse, but it's been great. I've been here for 1.5 years, and I look forward to working every day. It's so much fun to get this education out and to work with our families.
Yours is the one that was giving me some headaches.
I was having technology difficulties getting this PowerPoint to her, so there we go.
I think we're there.
Perfect. So just a big overview of hospice. So the definition of hospice is to provide a comprehensive, supportive approach to end-of-life care for individuals with a terminal illness, focusing on the quality of care, managing pain and symptoms, and addressing the client's and family's emotional and spiritual needs. So when we look at hospice, this is under your Medicare benefit or your loved one's Medicare benefit. And I'm getting this echo, so sorry. But anyway, so when you think about hospice and the Medicare benefit, if you're at that age, it will cover hospice 100%. It'll cover hospice for the care. It'll cover your medical equipment that you need, like a hospital bed. If you need a commode, any of those pieces of equipment. It'll cover dressings. It'll cover all of that. Everything's covered. The only thing that is not covered under your hospice or the Medicare benefit is, let's say you're on hospice for cancer and you have an eye drop that you do for macular degeneration. Hospice or Medicare will not cover that medication for you. So that would still be covered under how you paid for it normally before you came on hospice. So any of your medications that you take related to that hospice diagnosis would all be covered as well. Just those that are not, for what you're on hospice for. And then we provide services wherever you call home. We go into your home if you're in an assisted living, if you're in a memory care, if you live in a tent, we will come to you. So wherever home is for you, we bring that service to you or to your loved one. Because we all know that you want to keep your loved one at home, or you guys want to stay at home. And hospice will keep you at home for as long as you're safe. If there ever gets to be a point where you're not safe to stay at home, then we have some people on our team that can help you or your loved one figure out where that next step will be. So then, let's flip this. So when you come onto hospice, we have a lot of different services that we bring to you. We have medication management, so our nurses will work with you and your loved one, and also we have a medical director and your primary provider that are all involved with your care. So they will work with everybody to make sure you're getting the right medications at the right time. We will also have pain and symptom management. So we do bring in morphine and Ativan are the two typical medications that we bring in for hospice, but that does not mean that we are going to start you on those medications right away. If you don't need them, that's fine, that's great, but we always want them to be in the home. So let's say at 2 o'clock in the morning, you or your loved one has an issue where they get anxious. And if you don't have those medications, then you can't give them. So we always have them there if needed. And our nurses give all that education to you and your family and whoever's helping care for you so that you have that understanding. And then we have life enriching services, which is massage therapy, music therapy, volunteers, and social services and spiritual care that are all there to help you. We have respite care. And so what respite care looks like is we can do it in your home, where we can have a team come in. So we can have our nurse visit, we can have our home health aide come in, we can have a volunteer there, so we can be there for a good chunk of time, like whatever you feel like you need. So your loved one or whoever's caring for you can go out and do their grocery shopping. They can go out and do a medication or a medical visit if they need to. So we have that in the home, but then also we have contracts with some of the local nursing homes in the area where you can go in for you can bring your loved one in for an actual stay for up to 5 days. And that's once a month. So that if you have to go on a vacation, or if you need to go to a wedding, or whatever personal situation you need to go to, you can know that your loved one is in a spot where they are going to get that safe care. And then hospice continues. We still continue to go see your loved one even in those facilities. And then this one is always a tough one. So we are available 24 hours a day, 7 days a week. but that does not mean we're going to be in your home 24 hours a day, 7 days a week. So what that looks like is you typically have nursing in the home and like home health aid and any of those other ancillary services for a period of time during the day. Each one could be up to maybe an hour, but then it's not every single day. So typically 8 to 4:30 are when those visits would happen. After hours, we have an on-call service like home health does. And so that's where you can call a nurse at any point in time. If at 1 o'clock in the morning you have a question or a concern, you can pick up that phone and call them, and they will either triage your situation, give you tips or tricks, or else they can come out and do a visit, even if it's 1 o'clock in the morning. We're here for you. We're here for your loved one. And then we also provide ongoing education and support, because we know that hospice is sometimes a hard thing, but it's an amazing thing. It's an amazing service for everybody, and we hear that time and time again. So we're here, because we know you want your loved one to be safe and well cared for and have that best quality of life for whatever life they have left. And so the other thing I forgot to mention too is that other ultimate thing to come onto hospice is you have to have a terminal illness with a life expectancy of 6 months or less. But that doesn't mean that you're going to live for 6 months or less. I like to say, think of Jimmy Carter, our former president. He was on hospice for 2 years. So there's a big wide range in there. As long as you can provide that, or we can see that you have a decline, we can keep you on services.
I noticed you skipped the bereavement.
Oh, I did, sorry.
Do you still offer that in Wadena?
Yep, we do. So yes, the bereavement support, we have up to 13 months afterwards that we will help support the families and your loved ones for that first year firsts. So, to get through all the holidays. In the summertime, we have a super cool program that's called a Dove Release, and it happens out here at Sunnybrook Park. And we have a guy who lives in the area. He brings in, they're actually homing pigeons, but they look like doves. And we do a program where, your loved ones can share a story, a favorite story of them. They can bring pictures. We do some music, we do some prayers, and then we release the doves. And it is pretty super cool. I have goosebumps now just thinking about it. And then around the Christmas time, we have another program that's called Getting Through the Holidays, where our team, has a one afternoon that you can come in and they do some support, do a little craft, you can do some sharing time. And then also every month we have a program where you can come and, like a grief support group.
But you still have small groups that meet?
Yep, they do still have small groups that meet that you have to sign up for. And I can get you that information if you want it. I didn't bring that with me. I didn't even think to bring that with me. But we also have an open support group that happens once a month.
Okay. I went through this whole thing during COVID, so it was great because they did, and I did do the open.
Right.
Is that, I don't.
Yep, we still do the open one. It's at the Carvin Funeral Home. So that happens every month. I don't remember the exact date or which day of the week, but that does happen. Any other questions at this point? I'm all for open questions, because if you wait till the end, sometimes you don't always remember, so.
I remember they didn't get me hooked up with, because it was COVID.
Yep.
Don't come and go. But they got me hooked up with a program, I believe it originated in Sauk Center. It was sponsored, I believe they said, by 2 different churches. And what they did there, it was a format like we've used it at our church too, where they have a study, and you have a small group, and you get a workbook, so your small group goes through and answers the questions about that night's lesson, and then you watch a prepared video from a company that does it. Well, they couldn't, of course, we couldn't do small groups then, but I got it online, and they got me the workbook, and so then I could go to my computer, and I could watch the professional presentation, but we couldn't do small groups, and that was, but I thought that was very good, and I don't know if that's still available.
Yeah, and I honestly don't know on that either. If that probably could have been, that was before my time at Vivi, so we're just talking about a smaller support group that was available on a computer. So this is our care team that we have come in. So we have our nurses who, again, manage those meds, do those assessments, come up with a care plan, and your loved one is in control of the visit and the care plan. We have a medical director who's Dr. Dulsing out of Alexandria. Our team meets with him every 2 weeks and discusses all of everybody's care that they get. And then also he's available as needed. We have a nurse practitioner who is typically when we have to do those recertification periods, like with home health, we have in hospice, we have those certain period of times where you have to be recertified to make sure that you still qualify to be on hospice. And then we have your primary physician. So just because you come on hospice doesn't mean you don't have that primary doctor anymore, unless they won't, keep following you. And some facilities are that way, not Astera. Astera, the providers here really want to still be involved with your care, which is great. And then we have our home health aides that could come in up to 5 days a week and do those baths, do any small little homemaking skills, and be there just as a support. We have the spiritual care. So if you want that, you can have that service. If you don't, you don't have to. They will work with you with where you're at spiritually, and they can also help, get a hold of your clergy if needed. We have social workers that, once your family doesn't maybe they're not able to be at home safe anymore, they can help you find that next placement. Or if you want to do that respite stay, they can help with that. If you have any other paperwork that you need help with, because a lot of these things as families get older, there's a lot of paperwork that are hard to understand. Our social workers can help with that, amongst other things. And then our musicians can come in and play music for you, whether it's a guitar, a piano, they can sing your favorite song, they can sing hymns, they can do whatever you want. We also have massage therapists that come in and just do a light massage, so it's not like when you go to a clinic or to a massage clinic and you're all on the table. They just do it wherever you're comfortable and just do a light touch. And then our volunteers, which are amazing. They can come in, sit with you, visit with you, play cards, do some homemaking stuff. The sky's the limit on our volunteers. So it's just great that we have that whole big team that can come in and help care for you or your loved one. And then finally, the promise that we have to our clients is with being on hospice, we want everybody to have a good quality of life. And we do it to however the client wants their care to be, they're in control. And then we do assessments, we keep you at home, we support loved ones through the journey as they progress even into the next stages of their life, and the family as well. And then we also have a veterans program. So we honor veterans level 4, so our clinicians get extra care around that. And caring for veterans, we do a little veterans ceremony, have a pin, and they get a quilt and a certificate and everything. And then we have our musicians come in, and our nurses are there, typically our social workers are there, and we have a ceremony because we recognize that what they gave to us, so we want to help give back to them. And then we support our clients with dignity, and we want to make sure that the care plan is individualized, like I've said. And again, the life enriching services, so all those massage and all that kind of stuff, the respite and the spiritual care, and we anticipate the needs. So the cool thing about this, to wrap up, is we have tools that can predict, based on our nurses charting and our social workers charting, when somebody may be progressing into the next stages of their life without actually seeing signs of that. And so because of that, we could come out and support your loved one in your families even more, up to 7 days a week. So that's what I got. Any questions? So ultimately, any of our services, we want to keep your families and your loved ones at home. And there's just some of the options that are out in the community for you.
So you're wondering about other, like, nursing homes in the area?
Yeah, any facilities outside of your home that would be available.
Yeah. So we have a few different assisted livings. The Meadows here in Wadena is one that I can think of. I used to go in there a fair amount. Vitality over in New York Mills, and they also have a facility up in Sabika. South of here, Parker's has an assisted living, and there are some over by Staples Motley area as well. Lakewood has at least one, and then there are some small ones. There's also some adult foster cares. So they're usually like a home that has staff that the people live at, and staff come in each day and they work with them and they're there 24/7. I think of like Our Home, Your Home in Henning, Country Living over in Henning. There's a place called A Daughter's Love, and there's a few other ones in the area. If that's ever something you're really interested in, our hospital social workers can help find those facilities. I share an office with one of them, and I sometimes end up helping people with some of those resources. Nursing homes.
But wouldn't your county services have a list of all of those?
That-
Your, like, within the county, your assisted living, your nursing home, and what they provide?
They might, but it's probably going to be county specific, so you're gonna have to go to each county to find that, and we have quite a few counties pretty close to us here. And
Oh, I was just thinking of one place to go where you might get a list of this.
I think,
Within the county itself, not that you have to say.
Or within a 50-mile radius or something.
yeah, and actually, that is something that quite often now on cell phones, people will search assisted livings near me. And, well, to be honest, a lot of people do. That's where some of those smaller facilities that offer a little more personalized touch kind of get left out. A lot of them don't necessarily have a website. I don't know that like Our Home, Your Home over in Henning has that, but it's a great place. It's kind of a unique facility. It actually used to be a hotel, and there's people that own it that live there. They live in the upstairs, and all the residents are on the main floor. And they come down throughout the night and do rounds and check on their people and make sure that their needs are met. And then they go back up to bed, and they're always available by call. During the day, they also watch their grandkids in the same place. And Country Living actually does the same thing over there. So the grandkids get to mingle with the residents that live there. It was kind of neat. I went there on Christmas one day to take care of a gentleman, and they were making cookies together. And the kids loved it, and the residents loved it too. It was really a kind of neat thing. So the big facilities quite often are easy to search and find, and everybody knows about them. Some of those smaller ones, it kind of pays to ask, like the clinic or hospital social worker, or if that's something you're interested in.
A lot of times if you speak with your primary care physician as well, they can place a referral, which then comes to my team, and we can kind of work on that with the social worker and stuff too to find some of those places.
Yep. As far as nursing homes go, there is a tool on the internet, on the CMS's website. It's called Nursing Home Compare. You can search and you can designate the mile radius that you want to look in. You can search what nursing homes are available. It also will give you a little report about them. It'll give you their star rating. It'll give you some of their survey results and different client satisfaction measures. So that can be a consideration too, because you might think, well, I've got this facility, right down the road from me, but if it's not rated very good, maybe you want to expand your horizons, and maybe you want to look at some of those ones that are rated a little better.
What site did you say that was?
Nursing Home Compare. I know there's a link to it on the CMS website, Centers for Medicare Services.
Is the senior linkage line at all helpful for something like that?
Probably, I'll be real honest, Alan, my experience with that is pretty limited.
I have a little bit of experience with the senior linkage line. So yeah, the senior linkage line, if you reach out to them and kind of tell what you're looking for, they can also connect you with like home care services, hospice services, some of those other private pay services, Meals on Wheels, in your area. So they're really easy. If you call them, they will walk you through everything, where you live, they'll help you figure that out. I've had a couple of my patients use that, and they've had some good good results. Yeah, yeah. Because I'm like, I know a lot of the resources, but I don't know all of them. And so if the ones that I know are full, then I refer them to senior linkage, and I've had people have really good results with that.
Jim, getting back to your question about other facilities though, so you can search by internet search if you want to. A lot of times if people are already in the hospital, a social worker will help let them know what's available. We also sometimes have a pretty good inkling who has open beds and who doesn't, or who most families prefer and most families don't. So sometimes asking can be helpful. I would say within a 50-mile radius, and hopefully I don't forget any, Monaga, it's called Green Pine Acres. Wadena has Fair Oaks Lodge. Perham has their nursing home over there, Perham Living, I think it's called. Parker's Prairie has a good little nursing home. A nice little tidbit about them, if you're a veteran, they also have a contract with the VA. So you can get sometimes part, or maybe it's even all of your stay covered with that VA contract if any of you are veterans.
And that one's called St. Williams.
Yep, that one's called St. Williams. Let's see, Clarissa used to, for a little while, they were long-term care only. They are doing some short-term rehab stays now too. They are back to doing that. And that's Central Todd County Care Center, yeah. Lakewood and Staples. And well, Mills and Sabika are assisted livings. Yep.
And then there's 2 nursing homes in Alexandria if you
Oh,
want to go
yep.
that far.
There are, yep, Knut Nelson or Vivi has 2 nursing homes. One. And then there's, what's the other one called? Bethany on the Lake. Oh, and Battle Lake Good Sam is another nursing home over by Battle Lake. So.
Fergus Falls Veterans Home is a wonderful place.
It is, yes. It's probably just over that 50-mile radius, but it is. It's a good place. When I lived in Fergus, yeah, that's the thing. All of vets' homes, unfortunately, most all of them have a pretty long wait list.
You might be surprised though, I had a fellow who was 80 on the waiting list and he got in way quicker than anybody thought.
I know when I've tried to help people get in there, like some of my old home care clients, sometimes they were on that wait list for over a year, so.
They have opened up a couple other facilities outside of the area, so that has helped dwindle that list, but it's still long, so.
And I think they go a little bit too off of like who needs it the most. Like if somebody needs it intimately, I met with them once and they told me that there's like, these are ones who need it intimately. These are ones who just like want to be on the list, just thinking about it. They kind of two lists.
They may triage their referrals a little, I'm not sure.
And they also take spouses, they have a certain number of beds for spouses of veterans.
Yeah. Yep. Did you have a question?
If you go and put your name on a waiting list, and say your name comes up, but you don't want to go, or they don't want to go yet, is that how they work it, or how do they work it? You just sign up and...
You can sign up and you can always turn it down. That might move you back down the list a ways. It depends on facility operations, how they do that.
The one thing I'll say about with like facilities, each one's a little bit different on their criteria and how they do their wait list. So if you have questions on specific facilities or you're looking at a certain one, always call them directly and they'll answer their specific questions. And then one piece of advice I always give my home care patients if they're starting to think about assisted livings or nursing homes, if you can, go tour it with your loved one, because you'll know the second you walk in if it feels like home or it feels like a place that you'd be comfortable staying or having your loved ones stay. And some of them is perfect for one person, but maybe you need something else, and that's okay. So always, if you can, tour them. And then I always encourage my patients to plan ahead. So if you think you might need an assisted living in the next 2 to 3 years, start looking now while you're able. So when the time comes, you know where you want to go and you're not making a decision under distress and when you're not feeling good. Obviously, the social workers here are great and they'll help you with that. But if you kind of have an idea, oh, I looked at this place and I really liked it, it can kind of help your family too. Or if you're helping your family member, they told me they wanted to go here. Can we check there first for availability?
I have one other thing to add to that. If you plan ahead and start looking at it before you need it, you have a better chance of getting into the facility you want rather than whichever facility has a bed available when you have the need. So doing that is really important.
When you say go visit with your, but sometimes you can go just by yourself, but go at different times.
Incognito.
The only reason I know all that is my mother finally went into a nursing home and she was almost 98.
Yeah.
And we thought, we'll never, but we did, we found what fit her.
Yeah.
But now I'm looking for myself, so.
And, I think another thing a lot of people do, and some people they don't even think about doing it, is just asking other friends or loved ones what their experiences with other facilities have been. Because there's a lot of value in that, so.
What is the funding source for senior foster care?
I think a lot of times it ends up being like a waivered service, so the person has to have some funding through the county. Some people will privately pay. I know I had a gentleman out on one of the lakes out to the west of town that he did pretty good living at home, had family there most of the year, but when family wasn't going to be there for an extended period of time, he privately paid to go to one of those. And then I went and saw him there until his family came back, and then he moved back home. So sometimes that's an option if the money's there if people have the resources. Quite often it ends up being, I think so. I don't know that, I'm not sure. I don't know that Medicare will cover it like they do a nursing home because they're not offering skilled services. And that's typically what Medicare covers, is that those, therapies for rehab, after a stroke or a fall or whatever it might be, IV antibiotics or daily wound care. Those places typically don't have a skilled nurse there all the time to do those kinds of things. So they're not a skilled nursing facility, and I don't think would be covered under Medicare. So it'd be more of a county assistance or private pay, or maybe there would be some other, possibly supplemental. I don't know. I don't think so, but